Hi, hello everyone, welcome back to our channel. My name is Omotayo. So today I want to talk to us about the danger involved when we completely restrict protein food from the meal of anyone that is living with kidney failure. So I want to just kind of expatiate and tell us the risk involved when we completely restrict protein food from the diet or from the meal of anyone that is undergoing dialysis or having kidney failure. So come with me. So over the time, we always try to modify the diet of people living with kidney failure. We always try to help them prevent some complications that may arise from their meal, from their diet, such as a patient that is, take for instance, a patient that is undergoing dialysis. It is actually not advisable for such patients to be drinking a lot of water, especially when that patient is not having adequate section of dialysis. It is expected that in a week, someone living with kidney failure has to undergo like 3 sections of dialysis, for that person to live a normal life. But this is Nigeria, and we know how economy is. We know how it is difficult for people to have money, to get money for this section, for this therapy, because our insurance, our health insurance or health coverage is actually not responsible for many people's section of dialysis. So the only people that are actually enjoying all these full coverage, people that are working with corporate corporate companies, maybe patient working with NMPC, CBN, INEC, and so on. But when it comes to other would I put it now, when it comes to other civil servants, it's the difference is actually clear. So I can say it clearly that NHIS only covers 6 sections of dialysis for a year. So once you do 6 sections of dialysis in a year, that's the end of it actually. So NHIS health insurance is not actually going to cover more than that. In fact, some HMOs only cover 50% of these 6 sections, and once you exhaust those 6 sections, that's all. So this is, I'm just trying to tell you that these are the factors that make some people not to have adequate dialysis. Standard sections for dialysis is 3 sections in a week, at least for someone to live their normal life. So in a case where someone is just having a section or 2 sections in a week, you can see that of course you are not having adequate dialysis, and you shouldn't be doing what people that are actually having 3 sections should be doing. So when it comes to fluid intake, you have to minimize your fluid intake. You have to drastically reduce anything that is fluid, like tea, pap, oat, watermelon, water. You have to actually reduce it. It has to be measurable. You have to know the quantity of what you're actually taking in, just for you not to come with accumulation of fluid. Some people can be bad that they accumulate their fluid in their lungs, and once there is fluid accumulation in the lungs, you will be breathless. You won't be able to breathe well. You won't be able to, there won't be enough oxygen in your body, because where oxygen is supposed to be, there is fluid there, and so you'll be gasping for air. You'll be kind of having a labor breathing, because you are just trying to see how you can breathe. So please, it's important that you should reduce your fluid intake. Also, the diet that will totally put a restriction to, especially maybe when the value is high, is going higher, is potassium. Any food that is rich in potassium is actually forbidden for anyone that is actually having end-stage chronic kidney disease, because the kidneys are no longer regulating the electrolytes, especially the potassium. And once you eat food, especially yam, potato, plantain, banana, that this 4 fruit, they are so high in potassium that once you even eat it, your potassium may shoot up. So please, it's actually not advisable, it's not encouraging for you to eat food that is actually high potassium, because it will make you to have high potassium. That's hyperkalemia, which can trigger someone to have cardiac arrest. But yes, we've talked about food. I know that everything you've always been hearing is stop taking this, stop taking that, stop taking. But today I want to talk to us about what you have to be doing and the danger of not eating those things. Yes, I want to talk of protein diet. Many people, once they know that they are doing dialysis or something, everybody turns to become a dietitian or nutritionist, to know that, that the end product of protein is urea, and now once there is urea, that means your waist is increasing, and no, so now it will make you to be sick, and in a way to reduce your urea and creatinine, you have to stop taking protein diet. No, please, if you're on dialysis, please, you have to eat protein food. Because while undergoing dialysis, the dialyzer that is especially high flux tends to remove not just the waste now, it tends to move lot of nutrients, micro elements and all. So if you don't eat protein, the dialyzer will take out this element and you'll be looking sick. Your muscle tone, muscle, your skin actually needs protein. You know, one of the major characteristics of protein is even muscle repair. So if you don't eat enough of protein, believe you me, you'll be looking sick. And if you don't eat protein, you'll be having muscle wasting. Your body, your muscles like this, it will be just kind of, it's you like call it degenerating. It will just be losing on the soul, and it will, your skin will now be kind of flappy. So you'll be not looking, there is difference between somebody that is sick and somebody that is looking critically ill or critically sick. Please, if you are on dialysis, if you know that of course you've commenced your dialysis treatment, try to be eating protein food. It's actually helpful. We've already had this, I'll call it an experiment, and I could see clearly that eating protein food is actually, it's worth it. How will I call it? I've had this experiment, and truly restricting complete restriction of protein diet in a patient that is undergoing dialysis is a disaster. Yes, you can quote me anywhere. So complete restriction of protein in any patient that is doing dialysis is actually a disaster, because you'll be looking sick and your muscle will be wasting, and you are still coming for dialysis. The dialyzer is still removing what is actually inside your blood. So please be eating protein. You see that white egg, eat it with rice. You see fish, eat fish. You see small portion of beans with rice, please eat it. When it comes to amala, you want to, please eat beef. One thing is that people don't understand is that when you don't even eat balanced diet, food that is nutritious, your blood level will be low. Okay, fine, we know that kidney always helps in production of erythropoietin,